tobacco. So we are talking about shisha, we're talking about cigarettes, vapes, pan, healthy living, and seeing how we can make ourselves healthy. I hope everybody's enjoying Ramadan. It's going very, very fast, hopefully, for most people. Apart from the weather, it's getting a bit cold and chilly now all of a sudden, which just takes the shine off it a little bit. But mashallah, I'm sure everybody's finding the rosé are very easy this year. It's just so quick because normally we're used to 16 hours or 17 hours, but today it's only a 12 or 13 hours, and it's quite easy, mashallah. So I hope everybody's enjoying Ramadan. I'm going to introduce you to my guest, and he is a consultant at Leicester Hospitals. He's Professor Sanjay Agarwal, is the National Specialty Advisor for Tobacco Dependency at NHS England, Chair of the Royal College of Physicians Tobacco Advisory Group, Consultant in Respiratory and Intensive Care Medicine. Welcome to the show, Dr. Sanjay.
Thanks ever so much. I'm really
Professor Sanjay, sorry.
That's it. Thanks very much. It's really good to be here. Thank you.
No, thank you very much for coming in. You know, and are you Leicester lad, or what makes you stay in Leicester? Because I looked at your CV, and you are one of the world-renowned specialists in this area. You do lectures across the world, across the country. And why have you chosen Leicester as your base?
I was raised in Leicester, so I went to school in Braunston. I went to Imperial Infant School and Braunston Primary School, Folville it was called back then, and then Newark. So I'm a Leicester lad. I went to Gateway Sixth Form College. So all my roots are here. My family's here. My wife's family's here. So why wouldn't you want to live in Leicester?
It's the best place in the world. Exactly. I went to Gateway as well, so fellow Gateway students. But I'm sure you went a long time after me. I'm sure. So you're much younger than me by a long way. I'm sure. So it's so good for people to stay in Leicester and support their communities, and especially in sort of a field. We've got so many specialists, so many world-renowned doctors working at Leicester's hospitals. And, we don't realise that they could have gone anywhere across the world, but they've chosen to work at Leicester because it's home for them.
Yeah, no, exactly. And, people always circle back, I think, anyway, to their roots, actually. And for me, it's a huge comfort to be working in the town I was raised in and sort of give back, if that's a thing. But, I get a lot out of being here. And I get to see my friends that I grew up with and hang out with my, other fans and family. And it's great, and of course, supporting the local sports teams. And
Leicester City, obviously, yes. Of course, yes. If anybody's got any questions on any of the subjects that we're going to be talking about, you can call us on the landline number, which is 0116 4822 086, or you can send us a WhatsApp message on 077 488 55055. So, Professor Sanjay, lots of people in Leicester are from different communities, and the first topic we're going to tackle is shisha. So there's lots of shisha cafes, not just across Leicester, but across the UK, across the world. So whenever you go on holiday, there's shisha cafes everywhere. What's the attraction, and what's the attraction of shisha?
Well, I imagine the attraction is it's a group activity that you do with your friends and family. For many families, they've done it for generations and generations. You might see your grandparents doing it. For younger generations, it feels like a communal activity. It's sort of warm and inviting. You go to a nice place, you meet your friends. There's different flavours. So you can see from the outside why it would be attractive.
And it's more of a social thing.
Yeah.
And is this a larger problem in a place like Leicester? I mean, you're a specialist at the Glenfield Hospital. You see critical patients in intensive care at that unit, and you look after them. Is this a problem in Leicester of people having shisha too much?
Well, so I think probably for me the most important thing to say just right at the beginning is shisha has tobacco in it. And not only that, is it's burnt with some form of coal. And it's that combination of tobacco, inhaling burnt tobacco, as well as the cold, they release products that are bad for your health. And it doesn't actually matter what type of tobacco, whether you're using tobacco in a cigarette, a cigar, or any other form of tobacco, pan, for example. I think we're going to get onto these. All of these products contain tobacco. Burnt tobacco is the worst for your health because when you burn tobacco and you inhale the smoke, you're inhaling, each tobacco contains about 6,000 chemicals. When inhaled, you're inhaling them into your body. They immediately pass into your bloodstream, and they cause diseases like stroke, heart attacks, even things like rheumatoid arthritis, things that people don't know about.
So indirectly, it causes other side effects, not just about your actual breathing.
Oh, God, no. So tobacco causes 100 different diseases from, for example, dementia, deafness, macular degeneration, which causes blindness. It can make chronic pain syndromes worse. It can cause rheumatoid arthritis. It's responsible for about 15 different cancers: pancreatic cancer, bladder cancer, bowel cancer, lung cancer. And lots of people don't know. So when they're using shisha, they're inhaling burnt tobacco.
But lots of people will say, oh, it's just the flavour. I actually take the inhale it in my mouth and then exhale it straight away. So I'm not actually taking anything. Nothing's going down my lungs, and I'm just tasting the flavour.
Yeah, so I'm afraid those people are kidding themselves, because lots of chemicals get absorbed in your mouth. So some of your listeners might take a tablet called GTN for angina.
Yes,
and they'll know that they spray that into their mouth, and it gets absorbed from their mouth into their bloodstream.
And this is the same kind of effect.
And this is, so whether you take a deep inhalation or whether you think you're taking a light inhalation, nonetheless, it's being absorbed into your body.
And if somebody said to you, look, I only do shisha once a month for half an hour, and that's it. Is it in moderation? Is it acceptable, or is it just really risky anyhow?
Well, we all have, if you like, different thresholds. So, some people can do something. I classically get the story, oh, my grandparent, my dad, whoever, smoked all their life and they lived till they're 90. Well, that's great. That's great that one person, lived till they were 90 and they're able to do it.
You know the other story.
But I know the other story. I know the people who come in when they're 40 with lung cancer or a heart attack. So I would say don't use tobacco. There is no healthy level of tobacco use.
And do all shishas effectively use tobacco as their
yes
thing? Yeah.
And the problem is, I suppose that because they're often flavors, it smells nice, there's a nice atmosphere. People are lulled into a false sense of security that it must be safe. But just because something's flavored and smells nice does not mean it's safe.
It's almost a social thing. It's a social cafe to go in and have a shisha. And is there an effect of secondary people who are just sitting there next to the person smoking shisha? Is there an effect on them as well?
Yes.
There is. Okay.
Yes. And the other thing about shisha is, of course, oftentimes people are sharing the mouthpiece. And actually
contamination.
Yeah, the contamination of that. And in Leicester we have one of the highest rates of TB in the country, for example.
Yeah.
So back in the time of the COVID pandemic, you wouldn't share anything with anybody, would you?
No, you wouldn't even shake hands.
Yeah,
that's how far it went.
And you wear masks.
Yeah,
but we're willing to share mouthpieces. So I would say that whilst I don't want to be a damn squib on people's enjoyment, equally they should know when they go into these activities, they should have their eyes wide open. It's
informed.
They should be informed.
Yeah, and what about the people who say that I can't get off shisha? Is there an addiction to shisha because of the tobacco? Is that a real thing?
Yeah, it is. It's so all tobacco contains nicotine. Nicotine itself isn't harmful, but it's addictive, and so oftentimes people will feel that addiction by wanting to go and do it again, and that's why people get hooked into smoking cigarettes, for example, or cigars or shisha, because it's addictive.
It is addictive.
Nicotine is addictive.
Yeah. You're listening to Radio Ramadan on 87.7 FM. We're talking to Professor Sanjay Agarwal, and we're talking about shisha, we're talking about cigarettes, and the phone line for calling in is 0116 4822 or you can call messages on WhatsApp, which is 077 488 55055. So Sanjay, why? Obviously, shisha is really bad for you. are cigarettes much better, or they're similar?
No, they're all bad for you.
They're all bad for you.
So any smoked tobacco that you inhale, whether it comes as shisha, tobacco, cigarettes, cigars, they're all bad for you.
Okay. So lots of people say to me, "Oh, I don't really smoke, but if I'm in a group of friends, I'll have a cigarette," and they might have 4 or 5 cigarettes in a week, or 10 cigarettes in a week. Is that still as harmful as the person who's, Is there an advantage of smoking less over smoking a lot? And how many cases do you actually see that you think? What drives you? Is it thinking, "Oh, these people should stop," because you see the end result, don't you?
Yes. So in the hospital, we see the end results of tobacco. As I said, causes 100 different diseases. There's thousands, millions of people who die from tobacco every year. So across the world, there's about 8 million people who die. Yeah. In the UK, it's about 76,000. In Leicester, for example, we have 500 cases of lung cancer a year, thousands of heart attacks, hundreds of strokes, and the vast majority of them at some point are linked to tobacco smoke. So I cannot, hand on heart, ever say to you there's a safe level of tobacco use.
Okay. And what about the people who say, "Well, I only smoke a cigar, I smoke one once a week, and I don't inhale it"? Is that damaging to my health?
Same thing. It's smoked tobacco. There's not a safe level of tobacco.
And then we were talking, we mentioned Parn earlier. So there's lots of Parn shops in Leicester. Do they all have tobacco in them?
So most types of Parn have tobacco in them. Now, the difference between tobacco in Parn is that it's chewed, it's not inhaled. So if you like, the good news is that
it's actually in your stomach then, probably.
Well, you're not burning tobacco, and therefore you're not exposed to the chemicals that are found in burnt tobacco. However, you are chewing it, and oral tobacco, so things like Parn, can lead to fibrosis of the mouth. So people struggle to open up their mouth and can cause pain. And when people ingest the tobacco, it can lead to cancers in the bowel and further down. So it's not safe, but it's less harmful than burnt tobacco.
And what would your message be in a place like Leicester, where we've got so many shisha cafes, we've got so many people who are smoking cigarettes, cigars. I mean, the shisha is now the modern version. It's almost become a social symbol of affluence, and shisha bars across the city. When you go on holiday, every country you go to, there's shisha bars there now. What would you say? It's become fashionable, and that element has to change, doesn't it?
Yeah, so 60 years ago, 80% of men in the UK smoked, and 60% of women smoked.
Wow, yes.
Okay.
Yeah,
but now,
startling figures.
But now, the average is about 12%. So change can happen. And just because it's popular doesn't mean that it's not harmful.
Okay, yeah. That sort of makes sense. And realistically, what would you say, if somebody said to you, "Well, we've got to live, we've got to have a life. We can't just be all a nanny state, and we need to have some kind of sort of time to enjoy," and that might be one of their pastimes.
Yeah, and a lot of people who are addicted to tobacco, who use tobacco, they'll say those very things, and oftentimes it's because there's a vicious cycle. Because they're addicted to nicotine, when they're not using it, they have what you call withdrawal. So you get withdrawal symptoms.
So they feel down.
They feel anxious until they get their next hit. Okay. But actually, the thing to do is break the cycle altogether, and then you won't get the withdrawal symptoms.
Yeah. So at the moment, it's Ramadan. Lots of people have stopped smoking during Ramadan, and it's a great opportunity for people not to carry on smoking. And they've done a 12, 13-hour, 14-hour fast, so they haven't smoked for those hours, and lots of people give up. That's a great opportunity, isn't it?
Brilliant. So I would say, if you've given up, stop, don't go back. And one of the things is that it is a social thing, and that's why people find it difficult to stop. And I would say that lots of other people have stopped. Do what you can do. So one of the stories that I say to people is that, once I was doing a medical study at the hospital, and my patients had to stop drinking caffeine for a month before they could take part in the study of this new medicine. And I thought, well, I'm going to try that. It sounds really difficult. How am I going to do without my chai in the morning? It's going to be terrible. And it was the hardest thing I'd ever done, was to give up caffeine.
Yeah.
And I had to start drinking cups of hot water just because I wanted to be social. I wanted to have that feeling of I'm drinking something, but it wasn't caffeine. So, people find different ways. And what you can do is switch to other nicotine products that aren't tobacco. Yeah. So you can have nicotine lozenges, nicotine gum, and they're safe.
Yeah.
But because they're not tobacco. So you can switch to low-risk nicotine products.
Excellent. And lots of people are vaping. Lots of young people in particular are using vapes. What's the story with them? How good or bad are they?
Yeah, so vapes should only be used by people who want to quit smoking. They are not a recreational activity.
They've become that, though, haven't they?
They've become that, and it's terrible, and we shouldn't advocate it. So vaping is much safer than smoking, and the people that first started vaping were people who were trying to quit smoking. But the problem is the companies that sold and made the vapes saw an eye on the market and thought, well, actually, we could sell this to other people who don't smoke. And that's what they've done. They've made their products look bright and colourful. They've made them cheap as anything, and they've made them into consumer products. But they are not risk-free. So inhaling a hot, heated liquid is not good for your lungs. And so people who do not smoke and are not using vapes to quit smoking, shouldn't use vapes.
So the vapes were never there, really, as a new product. It was a product to stop people smoking.
Correct. They were a smoking cessation aid.
And all what's happened is it's become a fashion.
Correct.
And it's taken over.
Correct.
Wow. So it's not really helpful at all. And you can see the whole streets strewn with vapes on the floor, and you just think, what on earth is going on? All the packaging everywhere. And cities like Leicester, and I'm pretty sure lots of other cities across the country, have a huge problem with people vaping now.
Yeah, no, and so you may have heard in the press that the government actually trying to do something about this. They've just introduced a bill called the Tobacco and Vapes Bill, and one of the things they're going to do is to impose new regulations
on vapes,
and I think that's only a good thing.
Yeah. You're listening to Radio Ramadan on 87.7 FM. The landline number is 0116 4822 or you can send us a message on WhatsApp 077 488 55055. You're listening to Radio Ramadan on 87.7 FM. I'm going to introduce Ben. Ben, just tell us what you do and how you operate in Leicester City Council.
Yeah, so hello everyone. My name's Ben and I'm a Live Well coordinator based at Leicester City Council. So Live Well is an integrated lifestyle service, and the aim is for us to try and help people become healthier. So we run a stop smoking service, we run a walk-in program, we have a healthy lifestyle service, and then we can also refer people to drug and alcohol support as well.
So you do across the board services for people to try and get healthy. And is this open to everybody? Anybody can come along regardless of their background, or they don't have to pay for anything? It's all free, is it? Or
so Live Well as a service is just open for Leicester residents, and some of the services have a referral criteria, but some of them anyone can access. So if someone wants to stop smoking, they can just self-refer themselves, or if someone wanted to take part on one of our walks, again they could just come along and take part. But if they wanted to join our healthy lifestyle service, they'd need a referral from a professional such as a GP or a physio.
Yeah, but there is support, lots of support out there, isn't there?
Yeah, absolutely. There's a lot of support provided by Live Well, and anyone that wants to get in touch can just search Live Well Leicester on the internet, and they can find our contact details that way.
So if they just type in Live Well, it'll come up.
Live Well Leicester, yeah.
Live Well Leicester. And that's a great tip. I mean, there's lots of problems in Leicester with people with diabetes and high blood pressure and cholesterol and lots of other things. And trying to get them healthy is probably your challenge all the time. Yeah,
absolutely. And in December 2022, the Leicester City Council signed a healthy weight declaration. So someone's role within the local authority is to try and connect partners and bring people together to try and combat those type of issues that you're talking about. And
in Leicester City, you've obviously got a huge ethnic population, their problems are different slightly. They're really susceptible to diabetes and high blood pressure, cardiovascular disease, heart disease. Is there anything in particular that you're doing, especially in Leicester, in comparison to lots of other places up and down the country?
Yeah, so we have a community wellbeing champion network, and that is really at the heart of the community, trying to understand people's views and the challenges that they face. And we take time to go out and do focus groups and stuff like that, so we can really understand the challenges, and based on the things that come back, we can try and improve the services that we offer.
Excellent. And Professor Sanjay, we talked about blood pressure. Blood pressure is a major problem with the ethnic minorities in Leicester. What's the best way for people to control their blood pressure? Lots of medication, but is there anything else that we can do as a lifestyle with Ben and with other facilities around the city?
There's so much we can do. So having high blood pressure is a silent killer. It takes lots and lots of people away from us. It causes strokes and heart attacks. So the first thing is knowing whether you've got a problem or not with high blood pressure. So blood pressure is not something that you feel. It's, so you can have high blood pressure and you don't know it. So the first thing is get it checked. And you can buy home blood pressure monitors. Lots of pharmacists will do blood pressure checks. There's something called the NHS health check. So I think anybody over 40 can have an NHS health check.
That's a full screen of your bloods, everything, your blood pressure and everything else. So anybody can just go into their GP and say, I want a health check. And they will facilitate.
I think there might be criteria of being over 40 I believe.
Yeah.
And then actually the next thing is, okay, let's just say it's said to you that you've got a high blood pressure. Well, then your GP or your primary care practice will start you on medicines. People need to take their medicine. So I see lots of people.
So people come in to the hospital, end up in hospital because they're not taking their medicine correctly.
Correct.
Wow.
Correct. Or they've decided they don't need it or don't want it. So firstly, it's so know whether you have these conditions or not. Number 2, if you're starting on treatment, take the treatment. Number 3, self-monitor. So you can measure your own blood pressure. There are loads of apps actually as well. There's something called Zoe, and you can measure things like sugars and blood pressure. And then so I would say take charge of your own health. And then the next thing is activity. So it's really important to stay active. And I would say, and Zuffar, help me if I'm wrong, but I think lots of people in our community probably don't get enough exercise.
Yes, we're all guilty of that.
Yeah, and so just changing that. So, I got my mum one of these activity monitors that, people might have on their phones or you can get watches. And now she's addicted. She's in her early 80s and she will not rest until she's done 10,000 steps a day. Now, she might be unusual, but it's really important.
I better check how many steps I've done now. So if anybody's listening in there, who's done the most steps today? Let's have a listen to who's done the most steps today. You can call us on 0116 4822 or you can send us a WhatsApp message on 0774 8855 I'm just going to check how many steps I've done today, so that'd be interesting just to see, and because that's a great way of keeping healthy. And a lot of people who I've spoken to on the radio in the past said, we were borderline diabetes, sold my car, walked to work, walked back to work, got rid of the medication, off diabetes, lost a couple of stone over a year, and it's been really healthy and really good. And that's what you've got to try and achieve, because those little sort of steps of trying to get healthy, it would be good, wouldn't it? Oh, I've only done 3,500. That's not very good at all, is it?
I think you might have to go out for a walk after the show.
I need to, during Ramadan, we don't go out as far as we need to. So I need to double that at least to 6,000 or 7,000. So, because what should somebody be walking in a day? Should it be the 10,000 that you're talking about? Your mum is 83, which is fantastic.
So I think it kind of depends what your starting point is. So if you are completely sedentary and you don't do anything, then your first goal should probably be to become more active, and the step counters are useful. But step counters on their own, actually, doing 10,000 steps on its own isn't actually the thing. You need to do at least 150 minutes a week of moderate exercise. Now, exercise is defined as doing enough activity to be short of breath and hot.
Okay. Yeah, so basically, walking fast or running, one of the two.
You walk fast, or but some people
Or
want to
walk
do
up a hill.
dancing.
Walk up a hill.
Dancing at home. People might want to watch something on TV and do some dancing, and that's fine. It doesn't really matter what. Do something that you enjoy, so that you keep on doing it. Or if you've got grandkids, do something with your grandkids. The point is, it shouldn't be something that you feel that you're forced to do. You kind of got to enjoy it if you're going to sustain it.
Sustain it, yeah. And then sustainability is the key, because that'll keep your heart fit. I mean, you see lots of patients come into the hospitals, and are you concerned about the younger people coming in because they're not healthy enough? Is that a real issue for you?
So something like I just heard this in the press the other day. In the world, there's about 1 billion people now who are overweight.
Wow.
1 billion people. In the UK, we have one of the highest rates of obesity. Now, something that people should also know is that there's a new NHS program called the Digital Weight Management Program. So if your body mass index is, if you're Asian, 27, and you have either high blood pressure or diabetes, you can be referred to this digital weight management service, and you get a health coach to help you lose weight over a 12-week period. Okay. But you need to see your GP to get a referral.
That's really useful to know. I am a little bit overweight as well. Probably I probably need to do that as well, I think, more than likely, especially with the lifestyle that we live, running from one place to the other. Ben, how much support do the council give you, can give people to try and get them healthier?
Yeah, so if we just talk about our healthy lifestyle service that I mentioned earlier, it's a physical activity program that's based at our leisure centres. But it's not just about using the facilities at the leisure centre to be active. We can offer education sessions around sleep, self-motivation's a real big one that we talk about. We can talk around like what a balanced diet is and the key components around that. So depending on the service that's right for you, we do offer real one-to-one and tailored support.
Yeah, the problem is, people are in Ramadan at the moment. So what happens is we're all guilty of it, including me. We should be eating more fruit and vegetables, but we end up having a few too many samosas, a few too many pakoras and those kind of things. There's lots of these air fryers around now. Is that a lot better for you because you're losing the oil in the actual product?
But I don't know about air fryers, but in general,
oil is not good.
Avoid deep fried foods.
Yeah.
So an air fryer, you don't deep fry. It's got to be better.
It's got to be better. Yeah. And then I think lots of people have changed over the years. They have got more healthier, the fact that, no longer eating white bread, there's lots of wholemeal, 50-50 and all those kind of things and fruit and vegetables. Is there an active drive for trying to get more fruit and vegetables in the city and trying to support families who are struggling maybe, on the food banks and giving them more fruit and veg so they can help themselves, because they're probably more susceptible to lots of more illnesses than most other people. Is that happening, Ben?
Yeah, so the council does have a food plan, that they work on, and they look at issues like this. But we know that, especially around food, there's lots of complex problems, and people have different challenges accessing those kind of fruit and vegetables and that fresh food. So yes, it is something that is in the food plan, but it's a complicated picture.
Excellent, thank you. You're listening to Radio Ramadan on 87.7 FM. Telephone number here is 0116 4822 077 488 55055 is our WhatsApp number. I'll repeat that again. The WhatsApp number is 077 488 55055. If there's any message or any questions that you might want to ask, you've got the fantastic opportunity. We've got two of the experts, one on living well and one on anything to do with your lungs and your health, really, to be honest. You cover all of those aspects because you're an intensive care specialist, aren't you? I
am, and also across the Midlands, actually, we have the NHS prevention programme. So the NHS is trying to steer people into healthier living and preventing disease. So, cutting out tobacco, if you drink alcohol, reducing the alcohol intake, better weight, but also things like blood pressure control. If you've got an irregular heartbeat, making sure you're taking your medicines to control that, and blood thinners. That there's so much stuff that the health service can help people with. But it's really important that people also help themselves.
Yeah, they do their bit.
Yeah.
They help themselves as well, which is really important.
Yeah.
You know, you work at the Glenfield. That's renowned as probably one of the best hospitals in the world for heart surgery, cardiovascular issues. And do you feel that it's a cutting-edge organisation, and you feel that you're always moving forward and something always there to learn and research-wise?
Yeah, so we're really blessed in Leicester. We've got some fantastic services. So, for example, you know, our cardiology colleagues have introduced minimally invasive valve replacements for a long time. They did that a long time ago, actually, and lots of other centres have copied what we've done. In our intensive care unit, we have something called ECMO, which helps people who are really critically ill. And again, the Leicester team were the first in the country to have that for adults, for example. So there's, and within respiratory medicine, there's just world-leading research into lots of things like asthma, emphysema, and other things. So we're really lucky in Leicester to have such great services.
Yeah, and I just wanted to say, you know, on behalf of the people of Leicester and Leicestershire, a big thank you to all the people that work at our hospitals, particularly Glenfield, because, you know, the dedication and the compassion that you give to patients, you know, everything we always get feedback is, oh, you know, I went to hospital, they really looked after me, and you know, you save people's lives every single day, particularly when they're in intensive care, because they don't really have the wherewithal to realise who's looking after them. But, you know, lots of patients that come back from hospital say, oh, I wish I could have thanked the team. I wish I could have thanked the doctors that look after. So a big thank you on behalf of them, because, you know, I think, you know, people in Leicester and Leicestershire generally really appreciate, and particularly on this radio station, we've had so many people from the NHS on. As I was talking to you earlier, you know, we had a NHS collection day over the weekend for the charity, and on one day I remember coming in and we collected £250,000 in one day for Leicester hospitals. What a fantastic organisation and what a fantastic team! Because there is a burnout, isn't there? There is, you know, you're always working extremely hard, sort of every single day.
No, there can be. There's a lot of pressure, and actually, you know, there's a lot of, if you like, bad press as well sometimes, and people understandably get frustrated when they can't get seen as quickly as they want and as often as they want. But we're very lucky, I think, that Leicester Hospitals runs pretty well. We've got some world-leading services, and we want to carry on providing a great service.
Yeah, great, excellent. And you know, one of the things that people always say is the doctors are fantastic, the staff are fantastic, and you know, please reiterate that back to your teams, because that generally comes across. You know, because there is a life in Leicester with people who are living in Leicester, looking after people who are from Leicester. You're all part of one big community. And that one big community comes together all the time. And it's so great to see that. Places like the hospital, places like the council, places like the football club, and, you know, across this city. And you know, that's really great to see. And I'm sure you share that as well, don't you? Community's
really important, isn't it? I mean, I think it's that feeling of belonging, sharing things, giving back. And yeah, whether you work in the council, in the hospital, in the community, in, you know, doing in education, in sports, you know, it's all about community.
Yeah, and what happens is people always say, look, nobody cares. But actually, if you do care and people do go the extra mile, it just ripples across the whole of the city. You know, people just have that, you know, goodwill factor all the way across the city. And it is really important that we carry on that forward. I just wanted to also ask, you know, what would be your top advice, your number one advice to people listening to this show at this moment in time as to how to stay healthy? Would you say avoid the tobacco, or would you say more walking or exercise? What or food, diet? What would be the number one thing, priority that you would say?
Well, so actually I can't do it in just one thing.
Yeah, okay.
I would say that take control of your own health. So that's the first thing to say, take control.
So that means medication, checking your blood pressure, checking your diabetes, regularly going to your pharmacy or your doctor just to check what's going on.
Exercising and healthy diet, I would throw into that. So when I say take control, I mean do the things that you know will help your health. So don't smoke if you smoke. Eat a healthy diet, mixed diet with vegetables, fruit, fibre, don't overeat, don't overconsume, sleep well, exercise, stay active, and hang out with your friends. Make sure that you don't feel lonely. So one of the things that actually affects people's mood and their mental health is loneliness. So, being with your community, being with your family, hanging out with your friends is really important, as well as the other things.
Yeah, and we've got a message coming in. I'm going to read it out anyhow. Salam, as much as the great work Glenfield does, I think there's a statement that about them back in 2007. I went there with a chest pain. The nurses and doctors made me do laps around the ward saying it was muscular pain. 2 days after, I was admitted in a London chest clinic, and I had suffered a heart attack in my arteries, 90% blocked and having to have surgery, and suffered a severe range of my heart now, having to ended up on a pacemaker. There is things that do get missed, but...
Yeah, firstly, I can only apologise to the person that has left that message. That is terrible. So, again, not an excuse, but there are thousands and thousands of people who attend our hospitals every day.
Every day. I think the numbers are, there's something like almost 1 million outpatient appointments just at Leicester's hospitals. Yep. The numbers are absolutely massive. But I would always suggest to people, if you end up in hospital and you're not happy with the service, or you think you're not being treated properly, speak to the head nurse on the ward, or speak to your consultant. There's always a named consultant for every patient. And by all means, you have a right to talk to them and just say, I'm not happy with this, or I'm not happy. But please have that discussion, so that way it helps. Because, I get lots of calls from different people saying, I've had a problem at the hospitals. I always say to them, contact the consultant. They'll come and see you and explain what the problem is, because we're all human beings and they're all there to serve.
Nobody wants to do a bad job. And I would completely agree with you. If you're unhappy, let the team know that you're unhappy. Explain what it is. And there's something that's going to be introduced soon, I think, about getting a second opinion. Everybody should be able to have a second opinion. So if you feel that, people aren't either listening, or there's something missing that you're not sure about and you'd just like a second opinion, you can ask for that.
Yeah, I've been in with relatives and we've asked for a second opinion, and we've got it from another hospital. Another consultant's come in and seen them, and that is available. So, you have the ability to speak to the consultant, say, look, I'm not sure, can I have a second opinion? Most people aren't going to be, they won't have a problem with that, Sanjay. Would you?
No, I'd be happy, because I want people to leave satisfied.
You want people to leave satisfied. And one of the beauties about the NHS is they work as a team, don't you?
Yeah. Again, we're all after the same thing. We want people to diagnose the right condition, treat the right condition, and for people to have a good experience and be satisfied.
I certainly know when I've been in with relatives, the consultant said, actually, let me consult with my colleagues, let me share these pictures, and let me do this. And he's gone back and actually almost like a team briefing, multidisciplinary team meeting, and gone through all the notes, looked at everything, and said, actually, as a joint group, we've come to this decision. So they don't just use one head. You're not just talking to one person. You're talking to a team of people with the backup of the NHS, which is absolutely fantastic, really, when you think about it, because you can't have that in any private setting at all.
Yeah, so actually more and more now. So if you ask me, how has medicine changed over the last 20, 30 years while I've been working in Leicester, I would say more and more of our work now is done through a multidisciplinary team, where you have 10 heads or 10 people looking at
your notes,
at a case, and thinking about, okay, so what's going on here? What's the diagnosis? What's the treatment? This is our recommendation. So it's not coming from one person. It's a collective decision based on the experience of all of those people collectively.
So if you add the experience up of 10 people, maybe 20 years each, you've got 200 years of experience.
Yes.
And that makes a fantastic difference, doesn't it?
Yes.
Yeah. Absolutely excellent. And one of the things I wanted to ask you, do you get referrals from across the world? People saying, can you just advise me? I've got a patient with this. Does that happen with you?
Yeah, so with Glenfield, again, because we've got such a specialist service, we get referrals from all over the country. So especially, for example, our ECMO service, our intensive care support, we get literally referrals from all over the country.
And Ben, you're in the forefront of trying to get people healthy, trying to get them well. What is your message to those people, who think, oh, actually, I'm sitting on a sofa, I don't really want to get up, I don't really want to do too much. What would you say is the incentive you can give them to try and think, let me go and do this, or let me try and do this?
I think it's just, making that first step and that first step on your journey. And once you've made that first step, things can get a bit easier when you've got it in your head about what you want to achieve. But it's pretty much like what Sanjay said, you need that goal, you need that self-motivation to work through. Start off making small goals and, just try and build it up, and then you can achieve your long-term goal.
So if their goal is, I want to lose a stone in weight, you'd help them try and achieve that and see what you can do to try and achieve that. Because the more weight they lose, the healthier they'll become. Yeah,
absolutely. It's around that self-motivation and talking to that person, for example, and trying to highlight what they enjoy to help them lose that stone, for example.
Yeah. And your job is to facilitate how you can help them do that.
Yeah, absolutely. So it might be for a walk, it could be through our leisure centres, it might be going to the park and walking around the park, could be using the outdoor gyms. So it's just what that person enjoys really, because you want them to sustain it after they're finished with you and carry it on.
And it's things like swimming available as well then?
So you could use swimming, you could use anything really, anything that individual enjoys, dancing, gardening. It's just about making that first step and becoming active.
And they need to look on Live Well Leicester. If they Google that, it should come up.
Yeah, so if they want to access any of the services like we spoke about, whether they want to stop smoking, join in our walks, access the healthy lifestyle program, just type in Live Well Leicester. The information will be on there, and they can,
excellent.
Look to take part.
And that's for all illnesses, regardless of whatever they've got. Within reason, as long as they've been referred.
For the healthy lifestyle service, you need a long-term medical condition, and you need to be inactive to access that scheme. But with something like the walks, as long as they're steady on the feet, to be able to come along and join that.
I know some people who've done this. They've gone on a half marathon almost after about 2 years or 3 years, and they say they feel so much better, and their lifestyle's totally changed because of it. Is that what happens? Is that what happens when you... So have you seen people come in the programme and come out and you think, wow, what a totally different person?
Yeah, absolutely. I think that's the best part of the job. When we ask clients for feedback, they say how the service has changed their life, whether it's through stop smoking, whether it's through the activity programme that we provide, or even someone that's come on the walks, the friends that they've met, and that social aspect of it, that can change their life as well. So, a lot of clients that are coming through have had a great time and made real positive improvements to their health.
Excellent. Thank you very much, Ben. And thank you for your team and everything that you do at Leicester City Council for keeping people healthy. And let's try and keep promoting it and try and get more people out there walking around the streets or running around the streets or swimming in the leisure centres and doing lots more activity.
Yeah, thank you for having us.
Thank you for coming in. And Professor Sanjay, again, can I say a big thank you to all you and your teams at Leicester Hospitals for all the fantastic work you do. I know you go over and beyond what you do. This is all extras for you, what you do, because you have a passion and a drive for making Leicester and Leicestershire a healthier place for people and for the patients. So a big thank you to you and your teams.
And thanks for you and the radio station in terms of, doing this work and promoting it, because it makes such a difference to our community.
And that's why we're all here.
Yeah.
We want to make sure that we look after our communities. We're all, Leicester people.
Yeah.
And that's great to have that element of it. You're listening to Radio Ramadan on 87.7 FM. Next week, we'll have